Hello friends, in this webinar we will discuss issues in management of neonatal sepsis. The objective of this webinar is to learn a broad approach to the management, and we will not dwell upon the details of the antibiotics therapy. The same would be dealt in a separate webinar. We learned there are two different types of sepsis in neonates, early onset and late onset. This depends on the age at onset of sepsis. In general, we suspect early onset sepsis when there are maternal risk factors, or the baby is symptomatic within first 72 hours of life, or has the both, that means the risk factors as well as the symptoms, while late onset sepsis is suspected only if the baby is symptomatic. Both types of sepsis can occur in the homes as well as in the hospitals. Now, let us see what are different maternal risk factors. These are divided into two extreme risk factors, such as rupture of membrane for more than 72 hours, presence of chorioamnionitis, and foul smelling liquor. The other risk factors include spontaneous preterm labor, prolonged labor for more than 24 hours, prolonged rupture of membrane between 24 and 72 hours, and unclean or multiple PV examination. Some studies have identified UTI and maternal diarrhea also as the risk factors. However, these risk factors have not been consistently reported. We have therefore not included them in this list. This is the list of signs and symptoms that can suggest sepsis in neonates. These include lethargy or poor feeding, particularly in a baby who has been feeding normally earlier. Sometime a caregiver, a mother or a nurse may report that the baby does not look well, and this can be an early sign of sepsis. Respiratory distress, apnea, fever or hypothermia, vomiting, diarrhea, abdominal distension, seizures, encephalopathy, poor perfusion, shock, and rarer causes like bleeding, scleroderma, and renal failure. These symptoms are not specific to sepsis and may be present in other illnesses also. We learned there are two different types of sepsis in neonates, early onset and late onset, depending upon the age of onset of sepsis. In general, we can suspect sepsis if there are maternal risk factors or if the baby is symptomatic. We can broadly identify 4 different scenarios of sepsis presentation, 3 for early onset sepsis and 1 for late onset sepsis. The early onset sepsis can be suspected either because of maternal risk factors or symptoms in the baby, while late onset sepsis can only be suspected if the baby has some symptoms suggestive of sepsis. Let us examine the 4 scenarios of sepsis presentation. In the scenario 1, there are maternal risk factors, but the baby does not have any symptoms. Scenario 2 includes babies with maternal risk factors as well as having symptoms. In scenario 3, there are no maternal risk factors, but the baby has symptoms of sepsis. And the 4th scenario pertains to late onset sepsis, and this occurs in a baby older than 72 hours and the baby having symptoms suggestive of sepsis. So, what do we do in scenario 1? If there are extreme risk factors, as the likelihood of sepsis is very high in such a situation, we straight away start antibiotics without any delay. While in presence of other risk factors, the baby is monitored closely for vital signs and for development of symptoms every 6 to 12 hours for 72 hours. If the baby develops any sign or symptom suggestive of sepsis or hemodynamic instability, we start antibiotics. We should always take blood culture before starting antibiotics and perform LP if the culture comes positive. In scenario 2, there is presence of maternal risk factors as well as symptoms in a baby. In this situation, we start antibiotics. Of course, we send blood culture before starting antibiotics and also perform LP. As the management in scenario 3 and 4 is the same, we will discuss these two scenarios together. Scenario 3 pertains to a symptomatic neonate within 72 hours, that means early onset sepsis. However, there are no maternal risk factors. In scenario 4, the baby is symptomatic after 72 hours of life, that means the baby is suspected of late onset sepsis. In scenario 3 and 4, we should assess the level of sickness in the baby. If the baby is too sick, and this can be evidenced by presence of shock, scleroderma, bleeding tendency, respiratory failure requiring mechanical ventilation, seizures occurring in absence of asphyxia, severe hypothermia, or if there are obvious signs of sepsis such as presence of cellulitis, we start antibiotics without waiting for anything. However, if the baby is assessed not to be too sick, like the baby has an isolated episode of apnea or occasional vomiting, the baby with transient temperature instability, some reduced activity or mild tachypnea. In such baby, we can hold on antibiotics for time being and perform sepsis screen. The baby is treated with antibiotics if sepsis screen comes positive. If the sepsis screen is negative, we will look for other explanation for the symptoms and of course, follow the baby, and again we start antibiotics. We always send blood culture before starting antibiotics, and that takes us to the key messages. We should suspect early onset sepsis if the baby has maternal risk factors or symptoms suggestive of sepsis. We suspect late onset sepsis only if the baby has signs or symptoms suggestive of sepsis. We learned 4 different scenarios of sepsis presentation. In summary, we manage early onset sepsis based on presence of maternal risk factors and symptoms. If there are risk factors and no symptoms, we assess severity of risk factors. With extreme risk factors, we start antibiotics, while in presence of other risk factors, we monitor the baby, and antibiotics can be started if the baby develops any symptom. With risk factors and symptoms, we treat the baby with antibiotics. The babies without risk factors but with presence of symptoms are managed as late onset sepsis. In such babies suspected of early onset sepsis as well as those suspected of late onset sepsis, we assess the level of sickness. In a baby that is too sick or has obvious signs of infection, antibiotics are started at once. The babies that are not too sick, we can perform sepsis screen and treat if it is positive. Thank you.